Welcome back. Well, getting a massage doesn't just feel good, but it can also have positive health benefits. And joining me now to talk about combining holistic therapies and traditional medicine is Newington's Dr. Mariana Palukin. Thank you so much for being here this morning.
Thank you for having me.
So when you're talking about holistic therapies, what does that entail? What are we talking about here?
Well, we're talking about really integrative medicine. And integrative medicine is not a separate, only holistic. It is the combination of traditional medicine and additional other things that people have done for many, many years. We're talking about the care of the whole person, mind, body, spirit. And there are many things that we can do for the patients to improve their well-being, to decrease stress. And of course, massage, which people think most frequently of or commonly, it's only a small part of other things that could be done, and meditation and yoga, Reiki, all those wonderful things can improve your health, can improve the way you feel, can decrease the stress, and help you go through traditional treatments and sometimes chemotherapy in the care of people who have cancers and so many other different and important medical conditions.
So how do you suggest people start? Because if people aren't already doing these practices, aren't already meditating, what do you think is kind of a good beginner step?
I think it's always important to talk to your physician, to your regular doctor about this, and there are more and more of us who are learning integrative care more and discussing what treatments would be appropriate. And for some people, massage therapy for chronic back pains or chronic pain conditions, or meditation and relaxation when there is a lot of stress going on in your life, or hypnosis that can be used in combating side effects of chemotherapy. So I think it's a wonderful idea to discuss with your physician what is it that your goals are.
Sure. I know we talked during the break a little bit about how stress can cause or at least make conditions worse, you said.
The studies are showing that about 50% of visits to the doctors are either related to stress or made worse by stress. So acknowledging that, understanding that from the physician's perspective and advising the person to take care of that and also finding the best ways to do that for a particular individual, it's a first step.
So if someone's watching at home and they have stress in their life, what would you recommend? How would they start?
As I said, probably the first thing would be to discuss with your doctor. And again, many of us are open to discussions about additional treatments, not only medications. Of course, involving a therapist, a psychologist is a wonderful idea, but sometimes it only takes a visit to a holistic nurse, or it takes a good conversation with your physician and finding out that certain mild herbal medications or a chamomile tea or breathing exercises or meditation or maybe checking out the yoga studio would be a wonderful beginning.
And chamomile tea, why that specifically?
It has been used for many, many years, for generations, for probably thousands of years, as a very mild relaxation. Of course, when you try to start using herbal medications, always good idea to check with your doctor, especially if you're taking some serious medical prescriptions or especially chemotherapy. You want to make sure that there is no interference with what you're already taking.
Great. Well, thank you so much, Dr. Palukin. Some great information. To learn more about her, located right in Newington, head to our website, WTNH.com. Just click on that Honor tab, pull it down to the Good Morning Connecticut Weekend section.